Vendor lock-in obsolescence. That's what I'm talking about, right? Gatekeeping. Dead. Dunzo. Gone. And in healthcare, let's talk about what gatekeeping does. Because in healthcare, you have providers that don't have the materials and the supplies that they need to be able to deliver care for their patients. And those patients are in those hospitals receiving care from providers that have inadequate tools to do their job, that have been burnt out from the last 5 years of wish wash and flammery that we put them through in being our esteemed first responders that we totally forgot about. And then not only do those providers not have the supplies, but those patients that are in those hospitals, they can't afford to be there. At the same time, that the hospitals are all going bankrupt. And whereas the margins for the device companies are fresh and looking so hot, and the GPOs are having their events in Las Vegas, Viva, $100 blackjack tables at 10 o'clock in the morning. Oh my gosh. Different environment in healthcare. And we forget about the things that are important, which are the people inside of the buildings that are delivering the care, administrative, clinical, and the patients that are receiving it. All of them. That's the priority. Not your fees, not your lock ins, not your outrageous license costs. Forget about it. It's time, I believe, that we fix a broken system. And honestly, when it comes to the GPOs, I'm finding a hard time finding a justification. Really. And I'm not the only one. Most of the big systems are also having a difficult time finding the justification. You want to know why that is? Because every single time that these supply chains were begging for a break, favor was always given to the manufacturers. And that's the way that it's operated for years. And it has to stop because the patients and the providers have to start winning. And the facilities that they operate in have to continue to exist. So we should work on ending vendor lock ins. That sounds like a good idea. And that's all I'm going to say on that.